My name is Sonia Lucas, and my patient today is Susie Smith. Susie is a 22-year-old female and a full-time student. Susie presented with pain during her overhead weightlifting sessions and reached out to her physician for help. Her primary care physician referred her to me with a script for rotator cuff tear rehabilitation, and the patient and physician agreed to try a conservative approach to rehabilitation since it was a partial thickness tear. The rotator cuff consists of 4 muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. Together, they work to stabilize the glenohumeral joint, allowing optimal movement of the shoulder. Because of this, an injury to one of these muscles can affect shoulder kinematics greatly and lead to dysfunction in proper shoulder mechanics. The size of the tear can either be full thickness or partial thickness, depending on how many fibers are disrupted. And typically, partial thickness tears occur more frequently. Rotator cuff tears often present with 3 main symptoms: pain, weakness, and loss of range of motion. During my initial evaluation, I took a detailed history, and the patient has been weightlifting for several years with only minor discomfort with overhead Olympic lifts. Within the last 2 weeks, her pain has worsened, and upon visiting her physician, she had an MRI done, and it confirmed the doctor's suspicions of a partial thickness rotator cuff tear of the supraspinatus and infraspinatus tendon. Susie is having difficulty with reaching full active range of motion for flexion, abduction, and external rotation, in addition to having a painful arc. Patient learns best by demonstration and with verbal cues to ensure correct completion of exercise. Patient denied any barriers to her learning. So as I stated earlier, Susie has a partial rotator cuff tear of her right shoulder. So now I'm going to teach Susie 3 exercises that are going to help her in her rehabilitation of that rotator cuff tear. So Susie, why don't you come on over and sit down? The first exercise I'm going to be teaching you is called pendulums, and it's going to help us with a passive range of motion and to increase range of motion and flexibility in these early stages. So what you're going to do is take your left leg and place it forward. Your left arm is going to go and rest on the table. And then with your right arm, you're not going to contract your muscles at all. You're just using the momentum of your body to get a movement going in your right shoulder, okay? So you're going to rock back and forth and just kind of rock until you get a good movement in your arm. You're looking to make circles with that arm. So once you do get started, we're going to do 3 sets of 15 reps. So you're going to get 15 circles and then take a break. And when you're ready, you'll jump into the next set and do 15 more. Okay, for a total of 45 reps total. Okay, so I'm going to let you try that. My left leg is going to go forward, left arm, good. Bend down just a little bit more. Okay, now use the rocking motion of your body to get your right arm going in a circle. It takes a little practice, but you'll get it. So then, as I said earlier, we're just going to do the 15 reps, and that's 1 set, and you'll do 3 sets total. Okay. Any questions? No. All right. Okay, so the next exercise that I'm going to teach Susie is with a wand, and that's for active assisted range of motion. So Susie, why don't you come and sit down? So the first one we're going to do is to increase the motion of your arm going up to the side. It's also called abduction. Okay. So you're going to use your left hand to passively push your right arm up to the side. Okay. So you're not doing anything with your right arm. You're just using the left arm and the wand to get this motion. Okay. So you'll do 3 sets of 15, just like we did with the pendulum swings. Okay. Do you want to try that one? Yeah. Good. Make sure you're just using that left arm for pushing. Okay.
How high do I want to go?
Up to arm level is fine, but you don't want to push past or into too much pain. So kind of let your arm and your shoulder talk to you and follow that.
Okay.
So as long as that feels good, that range of motion is fine. Okay. You want to see the next one?
Yeah.
Okay. So the next one is for flexion, or basically for bringing your arm up overhead in front of you. Okay. So you're also going to use the wand, same thing, using the left arm to push the right arm up. So we're coming straight up. in front of us.
Okay.
And that's also for 3 sets of 15. So I'll let you try that one.
Okay.
Good. And then the same thing, don't push into pain. You just
Okay.
want to go as high as is comfortable at this point. And this is helping us get that extra range of motion without, again, contracting those muscles while you're still trying to heal.
Okay.
Okay, so the next one we're going to do is external rotation, or when you bring your arm out to your side. Okay, so same principles. We're going to take the left arm and push the right arm out. Just like that. Okay, you can act. Does that feel okay there?
Yeah.
Okay. So same thing, 3 sets of 15.
Okay.
All right. Thank you. Okay, so the next exercise I'm going to teach Susie is the sideline external rotation. So I'm going to demonstrate it for you first on the table.
Okay.
And then we'll switch places and I'll help you through it, okay?
Okay.
So you're going to get on the table and lay your head down here, get comfortable. And then we're going to put this little bolster underneath your arm. And this is a 1 pound weight that you're going to be using. So you're just going to come from this position up to about arm level. And we're going to do 3 sets of 15. Just nice and slow like that. And if you have any pain, just let me know and we'll adjust the exercise for you, okay?
Okay.
So I'll let you try that one. Okay. Place this under your arm. So at home when you're doing this, you can just use a towel, so like a kitchen towel, roll it up and place it under your arm, okay?
Okay.
And this, you could even use like a can of beans or anything that you have at home that's around 1 pound, okay?
Okay.
Go ahead and go through that motion for me. Good. And how does that feel?
It's hard.
It's hard?
Yeah. Harder than it looks.
Yeah. So if you get fatigued with that and that's too much, we want to listen to our bodies and you can go ahead and drop the weight or just do body weight
Okay.
because that's still going to help you.
Okay.
Okay? All right. So that concludes Susie's home exercise program, and the 3 exercises that I taught her were pendulums, and then using her wand to do active assisted abduction, flexion, and external rotation. And then the last exercise that we covered was the sideline external rotation with a dumbbell.